The COVID-19 pandemic threatens the health of millions of people in the U.S. and poses a unique set of challenges for the more than 180,000 people in North Carolina living with Alzheimer's and their caregivers. Joining us this morning to help us understand more about it is Peggy Beth. Peggy Beth, it's so good to have you here joining us. You're with the Eastern North Carolina chapter of the Alzheimer's Association. Peggy, tell me a little bit about what you're hearing from those in the community who are caregivers to people with Alzheimer's.
Well, thank you for having me, Jeff. I think one of the biggest issues that we're hearing from caregivers is the sense of isolation, trying to figure out, if they're caring for someone at home, what do they need to do to make sure the day-to-day care is going. But more so for them, it's the sense of isolation for them as well as for the person with Alzheimer's.
Now, you sent us a lot of information about resources that are available online, virtual different topics, the warning signs of Alzheimer's, understanding Alzheimer's and dementia. The list just goes on and on. Tell us a little bit about some of those resources.
Well, what we're doing in the coming weeks, because of how this pandemic has affected people around the world, and including the 180,000 North Carolinians, is to provide free virtual programming to expand and continue their education, but also we're offering virtual support groups. Our program is free. People can register by going to alz.org/NC, or they can call our 1-800-272-3900 helpline number and get registered for those programs as well.
What's the reaction been from some of the folks who have taken advantage of these programs? How helpful has it been to them?
It's been extremely helpful for the people, and the feedback that we've heard from people who've taken the programs. And what's interesting, Jeff, is that the biggest feedback that we've got that's been helpful for caregivers is the fact that if they're an in-home caregiver, that they've been able to be at home and still access the information and resources at their fingertips while being an active caregiver at home.
What other advice would you offer to folks who are caring for a loved one right now at this time?
My advice would be, to please follow the recommendations from the CDC and public health. Take care of yourself. Wash your hands. Everything that they're saying that we should do, practicing social distancing until we get to that other side. Take care of yourself so that you can continue to be the caregiver that you need to be.
One of the things that always concerns me about people who are caring for others is that you need to nurture and self-care yourself. What advice would you give to that caregiver to make sure that they are making sure they're replenishing themselves as they continue to extend that care?
Well, and I think it's finding outlets for yourself that you feel like that would be helpful to you. We've heard everything from caregivers that suddenly have developed an interest in doing puzzles, reading books, taking time for themselves. What this pandemic has done is provided new opportunities for caregivers to think outside the box, go for walks, just anything that they think would be helpful for them to renew their mind, but also renew their spirit.
All right, once again, Peggy Beth, the Director of Programs of Outreach and Alzheimer's Association, Eastern North Carolina chapter. Thank you for being with us this morning. Lots of useful information. We'll get this on our website so we can help folks out.